You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering dental implants. With us we have well-known periodontist, board certified, Dr. Stephen Brown. Dr. Brown, welcome to the program.
Thanks for having me, Randy.
Now, before we get into today's topic, I guess this is a big topic.
It certainly is.
Dental implants have become mainstream, as you say.
They have not only become mainstream, they've become predictable, they've become long-lasting, and they've become life-changing.
Now, when you say predictable, they don't fall out. Is that what we're talking about?
Indeed. We have over 40 years of experience now with dental implants. What I tell my patients is, if an implant survives a year, and better than 95% of them do, it'll last the rest of your life.
So what is a periodontist? We'll start there.
Well, a periodontist is somebody who deals in treating periodontal disease, which in fact is the largest cause of tooth loss in the world. And in fact, more recently, we've learned that the periodontal disease often has relationships to other systemic diseases, such as heart disease, stroke, premature babies, and a whole host of other things that we've learned. So periodontists are uniquely trained to do that, but more importantly, they are uniquely trained to do dental implants because they understand all of the tissues that are involved, meaning we understand how bone reacts to an implant, we understand how soft tissue reacts, and what's important to the patient is the ability for us to create something that is invisible.
So a lot could go wrong. We talked off camera in the hands of somebody inexperienced, because I guess any general dentist can do this. Is that right? This procedure?
Any general dentist can do it, and any oral surgeon can do it. We feel that the periodontist is uniquely qualified.
Biased, okay.
I'm biased, yes, uniquely qualified to do it. But in direct answer to your question, people who are unskilled can place implants. You know, what's important is the diagnosis, the treatment planning, knowing where and when and how to produce a successful result.
What are the different categories of dental implant patients you see?
Well, there's an entire spectrum of implant patients. The most common or the simplest would be a single tooth implant. This would be where somebody is missing one tooth and doesn't want to have their teeth cut down for bridges, and they choose a dental implant. If there were 3 implants or two teeth missing in a row, we can place 2 implants. Oftentimes, if we have to replace 3 teeth, we can do it with 1 implant on either side of a space and connect them. But one of the most rewarding types of implants are the kind that we give to patients who've been wearing dentures. Oftentimes, these patients have become what I call dental cripples. They are people who are unable to chew properly, they're unable to speak properly, they tend to cover their mouths very frequently, they don't like to smile, they don't like to laugh.
You say they don't know what they're missing.
They really,
elaborate on that.
They really don't know what they're missing. When someone's worn a denture for a long time, they adapt to it. We all adapt to certain things. Our personalities are such that we learn to live with what we have. And after a while, one forgets what they've lost. They've lost the ability to feel food in their mouth because there's plastic against their palate. They've lost the ability to not have to chop up food into pieces so that they can eat it more readily.
So you say with only 2 implants that oftentimes people count their teeth and they rule themselves out. With 2 implants, you could secure a lower denture. Is that correct?
One of the biggest questions I get asked is, how many implants do I need? Well, I can absolutely alter a patient's life for good with as simple as 2 implants. Dentures have inherent ability to cause tissue to break down, meaning if somebody has worn a denture for a long period of time, they will lose a lot of their jawbone, the height and the width of their jawbone.
Why? Because no pressure on the bone, or what is it?
This is because there is pressure on the bone. Once a tooth is extracted, there's an 8-time more probability that there will be loss of bone structure than when teeth are in place supporting the bone. So if somebody's been wearing a denture for a long time, they've lost the bone height both vertically and horizontally, which is what gives them that sort of kind of
sunk-in look.
Yes, it does.
Interesting.
And we could do more oftentimes than a plastic surgeon and giving somebody back their appearance just by giving them back their teeth, which restores the shape of their face, the height of their face, and gets rid of the wrinkles.